we talked about mitigation strategies, and the last one that we discussed, we talked about having a mild case of coronavirus, which reduces your risk of reinfection to 1 in 11 million. We talked about the vaccine. We talked about the use of melatonin to increase innate immunity. One thing that we need to understand here is, okay, here we go. All right, another thing that we can do is slow the spread of the virus. If you can slow the spread of the virus, then what that does is it allows your innate immune response time to come online and to kill the virus in its infancy. Because where we get into trouble is the virus spreads, makes tons of babies, and by the time the innate immune response comes online, it seems like a losing battle. So your immune system over responds and does more damage to the host. Okay, you understand how that works? So if you can stop the spread early, you give your immune system time to catch up so that it doesn't need to go all out and launch a nuclear attack because it's not feeling overwhelmed. When your body feels overwhelmed by an infection, it overreacts. It says, oh my gosh, we've got communists all over the place. Okay, our country is overrun. There's no hope. All we have is the nuclear option. All right. And so what you're doing by slowing the spread of the virus is that you're keeping it limited to just a few troops. And so when your immune system comes online, it can do a more measured response and kill the virus so that it doesn't have to do a nuclear attack. Okay. Now, one of the ways when the virus, it loves the lungs. And so when it gets into your lungs, the spike proteins attach to certain receptors. I talked about those earlier, okay? And when it binds to those receptors, it infects the lung tissue. Now, once it gets inside the lung, it has to infect other lung cells. Well, lung cells have plasma membrane that prevents a barrier. So how do you go from one lung cell to the next? You have to punch through the wall. Well, the normal way of doing that is to make so many babies inside the lung cell, and then you explode that cell. You make so many baby viruses that it's like you blow up a balloon, and then you reach it so full, then it pops, and now it can spread to other lung cells. Now, one of the reasons that the coronavirus can spread so rapidly is that in addition to blowing up the individual lung cells and spreading to its neighbors, it activates an enzyme called phospholipase A2, PLA2. Now, what does phospholipase A2 do? It causes saponification of the neighboring cell membranes. What that means is that it takes the lipids in the cell membrane of the lung cell, and it turns the lipids into soap. Just like, I don't know if I had a grandmother that made her own soap from lard. So they raised pigs. And so that's what they would do with the pig fat is they would add lye, and they would take the pig fat and make soap from it. She never bought soap. I mean, she had plenty of soap because she made her own soap from lard. And so you can do that to fat. You can turn fat into soap. Well, that's what phospholipase A2 does. It takes the fats in the cell membranes of your tissues, and it turns those fats into soap. And what does that do is it effectively dissolves the cell wall. Just like you see this guy kicking down that cardboard wall, that's what happens when you turn the cell walls into soap. You can easily penetrate those cell walls and go from lung cell to lung cell to lung cell to lung cell. Okay, see how that works? It's like acid. It's like molecular acid from Alien, okay? It just chews through the walls really fast. And now you don't have to blow up the balloon all the way and wait for it to pop in order to spread the virus. You can easily go from cell to cell to cell to cell by activating phospholipase A2. That's how the virus makes so many babies and spreads so rapidly in your lungs. Does everybody understand that? Does anybody not get that illustration? Okay, good. All right. So wouldn't it be neat if we had a drug that could inhibit phospholipase A2? If it did, then he'd have a much harder time kicking down that wall. Without the enzyme, he's going to kick and kick and kick and kick and kick. It's going to take a long time before that wall gives. And see, that's what happens if we had something to block phospholipase A2. Well, turns out we do. We discovered it way back during the first coronavirus infection, way back in the early 2000s. Okay, so with SARS used the same mechanism. SARS also activated phospholipase C2. That's how it spread. And so back at that time, research was done, and it was discovered that citicoline, which is an over-the-counter nutraceutical, it's an over-the-counter agent. It's used to enhance memory. I've been recommending citicoline for over 20 years for my Alzheimer's patients, okay? If you have memory disturbance, citicoline improves memory. How does it work? Well, see that choline, the other name for it is CDP choline, okay? And what that does is that allows your brain to make acetylcholine more easily. When you have Alzheimer's, there is a preferential loss of cholinergic neurons. And so taking citicoline allows you to make more acetylcholine and therefore improves cognition. And so we've been using this for years to enhance cognition in dementia patients. Turns out one of these side effects of citicoline is that it blocks phospholipase A2. Surprise! So it doesn't take very much. The normal dose, 250 milligrams, can significantly block phospholipase A2. And so it was shown to attenuate the spread of coronavirus. Almost 20 years ago, it was demonstrated that this blocks coronavirus spread by inhibiting phospholipase A2, okay? So we use it for a number of things, and by blocking that enzyme, that really helps your cells because now the coronavirus can't spread so fast. And we actually do have some studies that shows that if you block phospholipase A2, viruses are greatly attenuated in their spread. Specifically, coronavirus spread is reduced. So that's another thing that one can do. So yes, I recommend if you come down with this virus, if you're at risk for the virus, take the melatonin. But if you have any symptoms at all, take citicoline as well. Okay, and together they really help to slow the spread of this virus. Melatonin by increasing innate immune response, citicoline by attenuating the spread of this virus in the cellular environment, specifically in the lungs. Okay, so by slowing this virus down, we give your innate immune response, you give your innate system a time to come online and to kill it early without overreacting and putting your life at risk. Okay, any questions on that? Okay, very good. Now, the other factors. So what we just finished were the direct effects on the brain. It's not comprehensive, but hopefully I've given you an idea as to how moderate to severe coronavirus infection can absolutely impact psychiatric conditions. So for us as treaters, we need to be aware when a person comes in and they give us these symptoms, keep in mind, could this be directly from corona? You need to update Bixby voice to continue. Okay, thank you for that. All right, so basically you want to know, is this all psychological or is this physiological? Because if it's physiological, the patient will be relieved to know that, okay? Because very often they'll get better, but it's going to take some time. They just need to be aware that no, it's not your life. It's not your medicine's not working because of, because your depression is bad because of your circumstances. This could very well have a physiologic basis. So it helps them also to address their expectations. It might be a little more difficult during this time to get their symptoms under control, okay? Because there are physiologic reasons for their subjective their subjective depression, okay? All right, so now let's talk about the indirect effects. And next we're going to talk about things like guilt. I mean, if we have mild symptoms or if we test positive and then we pass this virus on to family members, that can result in some guilt, especially if those family members end up with mortality or great morbidity. So that's something we need to be aware of. And also, and this is very obvious, and I'm not going to spend much time on it at all, a lot more people are dying in 2020 than is average. The funeral home business is booming right now. I do have patients that are funeral home directors and funeral home workers, and they are very much overworked. We have considerably more people dying in 2020 than any year before. I mean, we have like record number of excess deaths. Some of them are due to coronavirus, others from corona-related factors. And so one of the things that we as clinicians have to realize is that these are normal things that we deal with all the time, just more of them.
So early on, I made the mistake of letting my older sister Amanda come over. She brought me some homemade chicken soup and brownies, even though I told her I didn't have much of an appetite. Then she tested positive for COVID about a week later. But with her, it was much worse. Amanda was overweight and she had diabetes. She had been on insulin for about 7 years. She developed COVID pneumonia and she had to be hospitalized for almost a month. They had to put her into an induced coma. We weren't sure if she would recover. Thankfully, she did pull through, however, her kidneys didn't, and now she's on dialysis, and they think it'll be for the rest of her life. Last week, our father, who lives in Cincinnati, died of COVID. He had a heart condition and was on 3 blood pressure medicines. He was found in his apartment, sitting on the chair next to his bed, and the doctor said it was COVID. We couldn't even have a proper funeral. People could see the body 2 at a time. The pastor said the eulogy outside on the front lawn of the funeral home. We were so far apart from each other that nobody even heard a word that the preacher said. 2020 has just been a terrible year for my family and me.
Okay, now this animation is taken from actual patient testimonies. These are my patients. I combined a few stories together, but all of these, this is true story. These are things that have happened in 2020. And these are actual sources of grief this year. So, I mean, there are a number of indirect factors in this new environment that contribute to mood disorders, morbidity in self or loved ones, long-term illness because of this, and then mortality, just the number of people dying. We've got 282,000 people dead in the United States directly from coronavirus, over 10,000 deaths in Michigan so far. That's a lot of people dying. Now, when the people that pass away are the most important people in your life, we sometimes see grief that pushes their loved ones over the edge. And so it's not unusual to have somebody die and then a very close relative or a friend will die within a month of that because of morbid grief. So these are things we need to be aware of. And again, this is not something new for us. We've seen this before, just more of it. So I just bring it up because in order to be complete, we need to talk about this and bring it up. I'm not going to spend a whole lot of time on it because this is stuff that as therapists and psychologists, we see this stuff all the time, just more of it.
What brings me in? I'm depressed. My life has gone in a really bad direction here, I was the manager of Flapjack's restaurant over there in Lansing, and it was a great job. The business has been there for 25 years. 22 of those years, I've been working there. I've been the manager for the last 20 years, okay? When I found out that it was going out of business, I was devastated. I couldn't believe it. It wasn't fair. We didn't do anything wrong. We had a great business model. It had lots of loyal customers. There was no way we were going to go down. It was hard. I mean, I imagine it's kind of what a divorce would be like, it's done. No more family. At least not at Flapjack. So I was heartbroken, and now my unemployment's about to run out. It's not like it was a lot. We were still not even getting by with the unemployment, and that's about to end. So my house is going to be foreclosed on. I am 5 months behind on the mortgage. 5 months. We're going to have to, my wife's job at Dollar General, that's not cutting it, okay? That's not enough. And we're going to have to move in with her parents. All right, can you imagine that? 7 people in a 3-bedroom house with 1 bathroom. 1 bathroom. Everybody's loving this idea, right? And, it's been rough. Me and my wife have not been getting along very well, so that's not good. We've got 2 children. My son is in 8th grade. My daughter is in 11th grade, and they're not in school. We're online. We're doing online stuff because we have to. There's no option. And they've not had any problems in school before, but now each of them are flunking 2 classes. Flunking. That's never happened before. Okay? It's partly my fault. Partly in the beginning, we didn't have enough bandwidth, so we had to spend more money for a better data plan. And that was it's going on our credit card, right? And then I know my wife is at work, and so I'm at home, and I'm responsible to try to, guide them and tutor them as they're doing this online stuff. Otherwise, I don't think they do it. And I'm not much help. I'm a restaurant manager. What do I know about trigonometry and history and all that stuff, right? So I can help my son better than I can help my daughter, that because her stuff is I don't want to say it to her, but it's over my head, So it's partly my fault that they're not doing well. And my wife's, she kind of blames me too. She didn't say it, but I think she does. I can't stop worrying about what's happening to us. I can't stop worrying about the future. When I go to bed at night, I lay there and I think about what's going on, what's going to happen, worrying. And so, I know it's bad for you, but I started drinking beer every night just so I could fall asleep. Well, that worked for a minute, and then it's 2 beers, 3 beers. Now I'm up to 5 to 7 beers a night. And it does help me fall asleep, but I can't stay asleep. I keep waking up all through the night, up and down, up and down. I think the most I'm getting, the total amount of sleep is like 4 hours. I'm tired all the time, but I can't sleep. It's a mess. My wife, she's handling it better than I am. Our relationship is strained right now, okay? I just feel useless. I know it's my fault. I feel useless. I just sometimes fantasize about how nice it would be to not be here. I'm not planning on killing myself or anything, but if I were to find out that I had cancer, I wouldn't want any treatment. I'd say, just give me the pain meds and let me out of here. Because just the stress, the pain of worrying, of feeling useless and not seeing a future, I just can't take it. That's why I'm here. I don't know what to do.
All right, so in that vignette, you've got a lot of issues. And again, these are all based on actual patient testimony. Everything that he described happened. People have had, this is a weird time. We've got a lot of societal factors that promote distress. And a huge percentage of our population experiences emotional distress a lot, which is great for business. Okay. I mean, we definitely have we have definite job security because a huge percentage of the population is very stressed out because of these changes. And all of the things that he cited there are real stressors for people. Okay. So the financial side of it, this has been a big hit financially. We've got thousands and thousands of jobs in this state that aren't coming back, right? This has really been the lockdown has especially affected small and medium-sized businesses. They didn't close down Amazon, they didn't close down Lowe's or Costco, but the smaller stores have taken a big hit and they still have to pay their mortgage and everything. And many of these places have gone out of business. Previously, most jobs in our economy were based on small and medium-sized businesses. Over 60% were based on these guys. This is going to change the landscape economically of the entire country. The economy was getting better up until, from 2016 to January 2020, the economy was on a huge upswing. Unemployment was at its lowest levels in my lifetime. And then COVID came along. And people, especially in leisure and hospitality, the amount of money lost from payroll in these areas is staggering, okay? So a lot of people, their source of income dried up, and a lot of companies have gone out of business, and people are really struggling financially there. Fewer than half of the population say they have enough money to get them out of, to last more than a couple months. Very few people have that kind of money laying around, and they can't afford this. The unemployment rate has gone up significantly. In 2019, it was 4%, and now in Michigan, it's up to 5.5%. All right. So those are problems. And one thing we know from treating patients for years is that economic problems are like a major source of stress for people. That's a major source. We hear that all the time. I don't think a week goes by that I don't hear from a patient where their financial struggles are a major source of the insecurity and depression that they feel. And so this just makes that much worse with the loss of jobs, loss of businesses. The divorce rates have gone up substantially here. Spending more time together didn't help marriages, okay? It actually has had the opposite effect, especially with young people. There's like a 34% increase in sales for divorce agreements. So 34%, especially in the South, all right? The divorce rate was going down. It was going down. By the time you get to 2020, it was like at an all-time low. It was a 50-year low in divorce rates. Now, part of that, I mean, before we get excited about that, keep in mind that marriages have also gone down. People aren't getting married to the same degree. So while divorce rates have gone down, marriage rates have also gone down. So you gotta adjust for that. Okay. Southern couples pursued divorce rates at 2 to 3 times the rate in other regions. I can't explain that. I don't know why that is. So I'm not even gonna give you a theory on that. I have no idea why that is. Okay. Quarantine made a big difference. When the quarantine was enacted, 16% more couples pursued a divorce if they had been married 5 years or less. So especially newlyweds, couples married 5 months or less, they pursued divorce at twice the rate of other people. So yeah, I mean, yeah, other people was 11%, but newlyweds sought divorce 20%. So it ended marriages much quicker. And it's not just having to spend time together. I think it's also the financial and the insecurity. And so everything just compounded. Okay. COVID-19 destroys marriages quickly. All right. So yeah, between the quarantine began March 25th and divorce rates spiked by April 13th, increasing 57% over a short time. Another horrible thing, and this is even more disturbing than the divorce rate, is child molestation. That spiked around the world. All right. And one of the things that gets brought up in the literature is that pornography usage skyrocketed during the lockdown. People were spending more time on their computers. And for many individuals, being on their computer, they gave in to the temptation to engage in looking at porn more than normal, and the children were available. Okay. And this spiked worldwide. Now, one of the things that those of us in this business understand all too well is that when it comes to significant long-term psychopathology, things like borderline personality and antisocial personality, when you add childhood trauma on this level, the psychological consequences for that child for the rest of their lives are horrific. Okay. I mean, some individuals have such severe pathology from being molested as children by a parent, by a family member. Okay. The effects are so horrific, it results in such severe pathology that I sometimes fantasize I would like to go back in time and just stop the original insult. I wonder, how would they have turned out if their brother or their father had just kept it in his pants? Why did this have to happen? Because this not just altered this person's future, but their children, their relatives, their loved ones, everybody now has to put up with a disaster because of what somebody with poor self-control did to them. All right. I really think that the punishments should be worse than they are. But this horrible thing has increased around the world, including the United States. And so we are going to be seeing the consequences of this pandemic for years, for the rest of our lives, for the rest of our careers. We are going to be dealing with the consequences of this pandemic.
A new report shows thousands of kids in Alabama are skipping school, and it shows grades across the country are plummeting. NTD's Christina Kim takes a closer look.
Preliminary reports show 5,000 students in Alabama's public school system aren't showing up to class, whether virtual or in person. Some may have switched to private schools, but many are unaccounted for, and the schools don't know where they are. Public schools lost about 4,700 students in 2018, but Alabama's education superintendent says this drop is more significant because it's widespread across the state. An expert in education policy says in Fairfax County, the largest school system in Virginia, F grades are up 83% over last year.
And vulnerable students, disadvantaged children, we're seeing huge increases among those students as well. Greenville County in South Carolina, the number of students receiving Fs has more than doubled compared to this time last year. We can look to Dallas, Texas, where last year at this time, the number of students who were on grade level in math in 5th grade stood at around 54% and has dropped down to 24%.
Burke says according to the McKinsey Institute, students will have lost between 3 months and 1 year of learning depending on the quality of their online instruction, and this impact compounds over the years. Burke says teachers' unions hold a lot of power and influence school closings. In November, D.C. public schools planned to reopen, but changed course shortly after the Fairfax Education Association, which represents public school teachers in Northern Virginia, said they don't want to resume in-person instruction until at least fall 2021.
And I would just add, so much of the union's effort to keep schools closed is not based in the science. It is based on politics more than anything else. And we can see that in places like Los Angeles, where the Los Angeles Teachers Union has said that they will not bless school reopening until things like defunding the police happen.
Okay, this is another casualty of the COVID situation is education. This Fairfax study is very scary. Our students in the United States were already struggling and doing poorly compared to students in other countries. So we already had an educational problem. This homeschooling thing is, this online learning thing is a disaster for education. I was a professor at Eastern and I mostly taught in the class. However, when I was on my way out, I switched to distance education. So it was like online. There was only 50% of the students that signed up for these online classes completed the course. When you are not in person, it's less motivating to pay attention, especially in difficult subjects like math, okay? And that's why this both in Texas and this Fairfax study show that math performance dropped tremendously. Math is hard. It requires sustained attention. Only a small percentage of students like math. And, you know, when you're sitting in a classroom and everybody else is paying attention, it kind of coerces you to pay attention as well. When you're home with distractions and blah, 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 blah is going on, it's easier to tune out. And that's demonstrated by what we're seeing. I mean, take a look at these numbers here. These are the charts from that Fairfax study, and an 83% increase in the number of students who are getting Fs in 2 or more classes, 100% increase in the male students, 100% in the female students, 100% in the Black students, students with disabilities, 111% increase in failure. So significant, I mean, the number of students, and think about, now why is this in a psychologic talk? Well, academic stress is a big source of depression and anxiety in young people. We know that. I mean, how often, you know, I don't see a lot of kids, but when I do see children, this is a very common thing. When they talk about what is the source of your anxiety, school ranks up there with like number 1 and number 2. Okay, so this is a big deal. So we're seeing a lot more academic stress.
So I was doing better with like my anorexia, but with COVID and everything and just the stress of my family and just my parents and just all the arguing and fighting, it's caused me to just be more restrictive with my eating and to have more problems with anorexia and just problems like controlling with what I'm eating so that I don't want to eat at this point, and just my anorexia is getting worse because of this.
Okay, when it comes to eating disorders, this is a perfect storm for many people with eating disorders, and it has resulted in a worsening. Just less than a week ago, I had a patient with a history of anorexia, had been doing good for over a year. I mean, she'd been doing great. And then COVID comes along, and she ended up having to be hospitalized. Her weight dropped back down into the 90s. She had been doing so well, but there are many factors related to the lockdown that caused a significant regression. Okay. If an eating disorder could choose its favorite environment, it could do no better than the stay-at-home orders issued by many states to combat coronavirus. Okay. Now think about this. You have fear over health, fear over food, social isolation, economic volatility, international sense of dread. You put all those together, and those are things that can make eating disorders worse. And then, when you have when you had those shortages going on here, that's not great if you have binging and purging issues, because you get this idea that food is limited. And so that causes a sense of hoarding and panic buying. And, this food's going to be hard to get, so get a lot of it. And the types of foods, like if there's uncertainty with regard to the grocery stores, if you're going to be hunkering down, then people buy food with a long shelf life. And those are the types of foods that in anorexia that you want to avoid because of the high calorie count. And these are also foods that bingers tend to binge on. Okay. And so you can see how this lockdown can contribute to that. Now you think, well, we're almost out of it now. We're almost out of it. And so this really isn't very significant. Well, are we? I'm a little bit hesitant to believe that, well, the vaccine is going to solve these problems. We have, politically speaking, we're in a very bad place right now. And because of this volatility, depending on what happens in the next few weeks here, we could see tremendous unrest on a level that we haven't seen since like the Civil War. That could cut down supply issues, and we could see something like the early days of COVID, only much worse. And so for people with eating disorders, this could come back with a vengeance. And so it's something to alert our eating disorder patients to, that, that this condition, acknowledge that our circumstances are going to make their challenges more severe. So let's think about this before they happen. Okay, let's talk about this in therapy. All right, so there are a number of studies looking at eating disorders in the time of COVID. And so many of these talk about the traumatic changes in our life with the COVID-19 lockdowns. Another thing that gets discussed a lot is, okay, if you have anorexia, what is the relationship between anorexia and COVID-19? All right. Social isolation can produce anxiety, sadness, anger, and loneliness. Social distancing, basically it quarantines you from social interactions. Those social interactions help people not to binge and purge. It helps people helps them to eat a better diet so that they're not so anorexic. Social isolation promotes anorexia and eating disorders. And so there are significant negative effects of this severe social isolation. You're isolated emotionally and physically, and those are mitigating factors. And so we have societal factors that put you at increased risk of eating disorders, and the protective factors, the social distancing thing, you get reduced social support, reduced emotional support, and reduced access to treatment. For those, for example, involved in group therapies, well, this is COVID world. We don't have those kinds of things, not in person. Okay, and there is a difference between online and in person. And so because resources to mitigate the symptoms of eating disorders are limited, and the factors that promote eating disorders are in abundance, our patients with eating disorders are at greater risk during this time of COVID. Now, there's an article that came out in Current Psychiatry talking about another aspect of this, and that is, if you have COVID and anorexia, is the COVID worse for those patients? The answer appears to be yes, for a number of reasons. All right. Now, for those with moderate to mild anorexic symptoms, The answer is no, it doesn't seem to increase the risk of infection or dying from COVID if it's moderate or mild. Actually being very low weight actually confers some evidence that it confers protection from things like infection. It actually makes you live longer with a restricted diet. So if you take a look at poor people in other countries where they just don't get a whole lot of calories, but they're not actually suffering from malnutrition, they actually do pretty well. So thin people actually do okay if it's just thin. But if it's below thin, then there's a problem. These people have protein calorie malnutrition or protein energy malnutrition. As a result, their production of white blood cells and the chemicals that help you fight infection are reduced. And so these people are at greater risk of both morbidity and mortality from infections. So they're more likely to have permanent bodily damage from the infection and more likely to die from infection if you have more severe anorexia. Right? Now, one thing to keep in mind, why is that? Well, adipose is pro-inflammatory. What do I mean by that? That means that when you have a larger body, when you are obese, those adipocytes increase overall inflammation. And it has to do with, you take your normal cell size and say a normal cell is this big, but when the cell fills up with fat, it becomes this big. And so what happens is that in a normal size, the principal immune cell is the type 2 macrophage. Should I go into this? I don't know. This might be too specific here. But bottom line, I'm not going to cover that because it's too much information. But I'm just saying that when you increase the amount of fat, it turns on something called, but it activates immune cells that are pro-inflammatory. I'll just put it that way. It activates pro-inflammatory immune cells throughout your whole body so that your immune system is now stronger. And so, but the thing is, with that inflammation causes, inflammation is at the core of most chronic diseases that kill you. So cancer starts with excess inflammation. Heart attacks and strokes start with increased inflammation. DVT start with increased inflammation. Autoimmune disorders, increased inflammation. Depression, increased inflammation. Do you know that the more inflamed you are, the more depressed you are? And the more depressed you are, it causes increased inflammation. So there's a positive feedback loop there. So being overweight, one of the things I recommend to overweight patients is losing weight. Losing weight, because as long as all that extra adipose is there, it is pro-inflammatory and pro-depression. So losing weight plays a very big role in helping them get better. Okay. But one good thing about adipose tissue is that because it's pro-inflammatory, it does help you fight infection, presuming you don't have diabetes. Okay. So fat helps you fight infection. And when you're looking at an anorexic patient, not a lot of adipose tissue there. Okay. And as a result, you have a very low inflammatory response, not very many inflammatory cytokines. Okay. So that's a big deal. Because when you get infected, how do we know you're infected? Do we count the organisms in your blood? No. We know you're infected because of the inflammatory response. You have a fever. You have redness of the infected organ. Okay? You might have some pain. You might have respiratory symptoms like the sniffles. Those are all not the organism, but the inflammatory response to the organism. So inflammation tells us that you're sick. And the earlier we can identify that you're sick, the earlier we can begin treatment. People with anorexia, when they get infected, the symptoms of the inflammation is less and it shows up later. So therefore, the infecting organisms get a head start. Okay? Now you also have many anorexic patients that are into excess exercise. What little they eat, they try to burn off by exercising. Okay? Well, when you exercise, that stimulates anti-inflammatory myokines, so that reduces inflammation there as well. So they have reduced body fat, which reduces inflammation, and then they exercise, which also reduces inflammation. And so therefore, if they get infected, once again, we have two mechanisms by which they are not going to show the normal inflammatory response. So because of their low ability for inflammation here, what happens is that the bacteria or viruses get a leg up on them, okay? And they are more susceptible to being overwhelmed by these infections. And also in the medical community, they can have, like, say, for example, coronavirus, and we don't know they have coronavirus because they're not having a fever. They're not showing signs of infection. They're not having the sniffles or anything, but the virus is inside of them, busy making copies of itself. And by the time they develop a fever, by the time they develop symptoms, it's too late. The virus has gone hog wild, and now they went straight to moderate to severe disease. So yeah, in anorexic patients, the impairments in the inflammatory system can cause significant damage. And people with COVID-19 are more likely to have more severe COVID infection, okay? Now, the other thing is that when you have anorexia, many of the lab studies that we expect to see with COVID infection, they have all the time. So just by having, you know, when you have COVID-19, you got lower lymphocyte counts, higher leukocyte counts, specifically polymorph neutrophils, elevated levels of inflammatory cytokines such as tumor necrosis factor alpha, interleukin 6, tumor necrosis factor receptor 2, decreased levels of C-reactive protein and interleukin 6 receptors. These are things that people with anorexia have, and elevated levels of TNF alpha and interleukin 6. Bottom line is that they look similar. If you take a look at the laboratory findings in somebody with COVID-19 and somebody with anorexia, there's a lot of overlap. And so what that can do then is that it makes it difficult to know that your patient has COVID-19 just by looking at the labs. You have to literally test for COVID-19. So it's important for people with anorexia, if they have exposure to a COVID person, they need more frequent testing because you're not going to get the warnings that you will have with non-anorexic patients. And patients, for example, with influenza, if they have low protein energy if they have protein energy malnutrition, let's say they've been restricting, they've been on a really big diet and they have not been getting enough protein, if you give them protein, suddenly their ability to fight influenza goes way up. It is like it's part of the treatment for their viral infection. It can save their life, okay? Now, if you have somebody with anorexia, getting them to consume those calories can be a challenge. Those are the calories that they need to save their life, though, because that kind of, if you have infection and you have low protein, you got to get that up in order for your immune system to have a chance at fighting this virus. So it's important that we communicate that to our patients, okay?